first I thought about how the turnover ratios may have increased, or like the reasons why I've left employers in the past. So I sat down with my therapist and I started talking about this problem, as I do most of my problems. And she points out that the reasons I'm listing off on why employees tend to leave employers also relate to mental health. So I looked into this, and I found that the global economy loses around $1 trillion every year due to lack of support for employees. And I looked into how many millennials are suffering. And I found that 20 million millennials in the United States suffer from a mental health condition. It's over 1 in 4 millennials. There is a problem, there is a solution. You play a role, and we can all benefit. So what is mental health? A mental health challenge is a condition that affects a person's thinking, feeling, mood, or behavior. I've been clinically diagnosed with 4 mental health conditions, and I have tendencies of others. So mental health is on a spectrum. So although you may experience anxiety, somebody with bipolar disorder, ADHD, depression, they'll experience anxiety in a completely different way. The most recent data published is from 2017. In the age group of 18 to 25, now this is just a portion of millennials, this doesn't include all of them, but out of that age group, 25.8% of them have been diagnosed with a mental health condition. So this doesn't include the people that were unable to see a doctor. And compare that to the age group of 50 and over, 13.8% of them with a mental health condition. Now out of that 26%, 38.4% of them were able to seek treatment, as opposed to the 13%, 44% of them were able to seek treatment. So where's that gap coming from, that although more millennials are suffering with a mental health condition, less of them are able to seek help? Self-esteem, money, and work. So these are the 3 factors that contribute to a mental health condition. Now self-esteem is a broad topic. There's a lot of factors that go into that, but I want to focus on perfectionism as this relates to the workplace. Self-oriented perfectionism, socially prescribed perfectionism, and other-oriented perfectionism. So the self-oriented perfectionism is my irrational need to reach overly ambitious goals. When I was 17, I had dreams to become a pediatrician that specialized in infectious diseases, and I wanted to live in Africa working on the HIV epidemic. I know, really ambitious. Around the time of my diagnosis of anxiety and depression, I was 20 years old. I was in my 3rd year of University of Iowa. I was so consumed with the stress that I was experiencing that I ended up having mono for 2 months, and I was unable to attend school. As a result, I soon after dropped out of college. So the stress that I put on myself for not becoming a doctor, but not even finishing my bachelor's degree, really devalued my self-worth. Socially prescribed perfectionism is the pressure that we receive from others to reach these ambitious goals. So the pressure we get from our parents to become doctors and lawyers, or managers that expect 2 employees to be able to perform the same way. Or even a conversation with someone and they ask, when are you starting your family? Other-oriented perfectionism is having unrealistic expectations of others. We live in a society that we are told that it's not okay to tell others how we like to be treated. So when our managers have conversations with us and they can feel disrespectful or ineffective, we can become frustrated, angry, or even resentful. So Melissa's hit a lot of the money, but I want to emphasize this element as we are the generation of the side hustle. For 10 years, I worked 2 jobs to be able to afford my style of living. As millennials, we understand if it's not an economically sound decision for our employers to be able to pay us enough to afford a house in Seattle, or the lifestyle we want to live, or to be able to anticipate car repairs. So we work 2 jobs. So not only are we dealing with the stress of having more debt, less income, and a higher cost of living, but also all the workplace stress factors I'm about to discuss, we're not only experiencing them from your place of business, but from our side hustle as well. So how does work tie into mental health? Inadequate health and safety policies, poor communication and management, limited participation in decision making, low levels of support, inflexible working hours, and unclear tasks and organizational objectives. Now I could give examples of each of these, but I want to focus on 2. With safety policies, this could be something as simple as, is your employee walking home late at night? I worked for an employer that we were in a high theft, high burglary situation, and it was in the company policy that anybody closing down the store had to close in pairs. This helped ensure our safety amongst each other and that we were taken care of. The other story I think of is I have this friend a few months ago who lost his father. And his employer gave him a month off for bereavement. And upon his return, he was in a sales position. After 3 weeks, he was still unable to hit his numbers, so his manager calls him into his office and says, "You're not performing. We need you to hit your numbers or it's time to move on." He was let go. So not only did that create the stress among the employee that was let go, but the ripple effect it had on the employees that remained, that saw that low level of support for their colleague. Absenteeism, work performance, staff attitude and behavior, and relationships at work. These are the 4 areas where mental health will manifest in the workplace. People with a high adverse childhood experiences are 10 times more likely to experience physical ailments, so backaches, stomach ulcers, migraines. And these are ailments that will physically prevent them from being able to show up for work. A mental health condition can also affect their work performance, their ability to focus, be able to perform effectively and efficiently and accurately. And then mental health can also affect attitude and behavior. I know for me, one thing I struggle with is finding my value in a social setting. I struggle with, do they care what I have to say? Do they respect me? Do they even want me here? And it may seem that I'm reserved or disengaged, but really I'm just struggling with my own self-worth. In relationships at work, being able to communicate effectively with our managers, our colleagues, our clients. All of this can result in disciplinary actions. And when suspensions and write-ups occur, this will increase the stress and create those more physical ailments, leading to more absenteeism, lower work performance, and the cycle will just continue. So what do our solutions look like? Employment provides 5 categories of psychological experiences that promote mental well-being: time structure, social contact, collective effort and purpose, social identity, and regular activity. The absence of time structure for somebody with a mental health condition can be incredibly overwhelming, not knowing what to do, where to focus. Social contact, I definitely spend more time with my colleagues and my coworkers than with my friends and family. Collective effort, being a part of a team that we're all working towards a good design, a happy production, a great outcome. It creates a sense of community and togetherness. Social identity, the first thing I do when I meet somebody is I introduce who I am, who I work for, and what I do. Unemployment can also lead to a sense of identity crisis. And regular activity, having those consistent behaviors, that familiarity creates a sense of comfort. So this here shows that people with mental health and millennials, we want to work. Working is good for us and it's healthy for us. So how can you help? Studies have shown that for every $1 of investment for treatment and support leads to a $4 return towards the business. So implement and enforce health and safety policies, inform staff that support is available, establish programs for career development, involve employees in decision making, and recognizing and rewarding the contribution of employees. Now, it may seem like I'm going to put gas bars on a pedestal. However, I've noticed an increase in my well-being and mental health since I began working for Sarah. I'm provided with health insurance, so I'm able to afford a therapist and a doctor and get the treatment that I need. I know that support is available as I've called my manager and Sarah multiple times asking for help. I know that if I can continue down this path, this is what my career will look like and this is my trajectory. On a monthly basis, we have all company meetings, and quarterly, annually, Sarah takes this as an opportunity to receive feedback on how the company can grow and continue to develop. Now, whether or not she takes that feedback and implements it is up to her, but at the end of the day, I still feel heard. And we also use these monthly meetings to spend the first 15 minutes giving each other kudos. Thank you for coming to my job site this week. I am so grateful you took the time to answer my questions. You did a really great project, good job. These kudos, these attaboys, not only support and recognize the greatness that's being done, but it also shows other employees that it's okay to ask for help. So what does that $4 in return look like to you as the business? reduction in absenteeism and presenteeism, lower turnover, decrease in safety and quality incidences, and higher productivity and profitability. Now, this also doesn't include the labor costs for having to hire more employees for your higher turnover, or FMLA costs for employees that need to take that leave of absence. So what can you do? You're all in a position where you can create the culture and the environment to help develop and support your employees. So check your policies. Flexible work schedules and start times, reduce distractions or noise, working from home, written directions and task lists, regular written or verbal feedback, flexible break schedule, private quiet space to rest during a break, and the use of a job coach. Another thing Sarah provides me with is a weekly communications training. This not only helps me perform my job more effectively and efficiently, but it also helps me establish goals and learn the skills to work towards them. As I've done my research, I found that this trend of mental health is not slowing down. In a recent poll on Generation Z from 2018, it found that Gen Z is already polling at 80% of them are stressed out. This will continue to manifest into these mental health conditions and create this workplace tension. And when I think about employers that I've worked for in the past and what I've done, I don't choose an employer based off of my job description, my daily activities, and my responsibilities. I choose to work for an employer that supports me, my mental health, and my well-being. Thank you.
Chelsea, thank you.